Welcome to HealthWatch, presented by Novant Health. I'm June Baker, and I'll be your host today. We have a really great show planned for you today, a combination of clinical folks and foundation people. Our first guest today is Elizabeth Wassam, and she is the philanthropy manager here at Novant Health Brunswick Medical Center Foundation. And our next guest will be Dr. Christopher Swiger, and he is a cardio-oncologist with the Novant Health Heart and Vascular Institute. And lastly, we will meet nurse practitioner Jennifer Suzanne Blevins, and she's from the Novant Health Express Care at Walgreens located in Leland. So stay tuned to this episode of HealthWatch. Please welcome our first guest, Elizabeth Wassam, and she's the philanthropy manager here at Novant Health Brunswick Medical Center Foundation. Welcome, Elizabeth. I'm so glad to see you again.
Thank you, June. It's great to be here.
Wonderful. I know that some folks out there are going to recognize you because you have a history here in Brunswick County, and you and I met a long time ago, and now I'm so happy that you're here with us at Novant Health. So tell me a little bit about your background and how you got to be where you are today.
Okay, gladly. Well, it is great to be here at Novant Health. I've been working in the county for the better part of the past 6 years, and have been in the area a little bit more than that. I grew up in Virginia originally,
Really?
And came here by way of New Jersey. Yeah. So it is fantastic to live and work here. Grew up going to the beach at Holden Beach with my family.
Oh, yeah.
So it's kind of a dream, and it's a very familiar community compared to where I grew up.
That's awesome. And that's so, I think that's very helpful in your job that you have lived here long enough that you understand the community, the demographics, and what have you. So you're kind of a local girl.
Thanks.
So what intrigued you and drew you to this position at Novant Health?
So I really feel called, led, what have you, to connecting people.
Yeah.
And so the opportunity to do that here when there are so many exciting things happening in healthcare in Brunswick County was really thrilling. And I was looking forward to professional, personal growth, and have really been excited to generate the energy around philanthropy, because I believe there's a lot that can be done here with the power of philanthropy for Novant Health Brunswick Medical Center Foundation.
I totally agree with you. Tell me what your first few weeks, because you've only been here a short time, but what have your first few weeks been like here?
They have been really great, but at times overwhelming, I will say.
I'm sure.
Meeting so many team members and getting to know what we do here in healthcare has been a big part of it. Mm-hmm. So the team members have been so warm, so welcoming, helpful with many questions, and I have a lot of them. And I think as far as healthcare and learning a new industry, what's really amazing is the range of what takes place here.
Yes.
You have the happiest days of people's lives, babies being born, and then you also have really difficult days.
Yeah, you do. Yeah, it's sort of a combination of all things. We've had weddings here in this very room. We've had memorial services. So it just crosses the whole gamut of experiences and issues. So tell me a little bit about your role here with the foundation and how you interact with the broader Novant Health Foundation.
Yeah, absolutely. So The Novant Health Foundation is a system of 6 hospital-based foundations, and Brunswick is one of them. And what's beautiful about that, the foundations being embedded in not only the sites where they're serving, but also the communities, is that we really have a chance as the team members and me as philanthropy manager here to work side by side with those on the clinical side of things that that know the needs. And so then we can work together to really align those needs with foundation priorities, and the needs are great. I mean, there's so much to be done as far as enhancing services, which is a function of the foundation, enhancing services, accelerating programs, and really supporting access to healthcare for all of Brunswick County.
And you touched on fundraising initiatives as well as growing services and what have you. What are some of the main focuses of the foundation right now?
So we are highly focused on an emergency room expansion campaign
I've heard
for behavioral
about that.
health. You have?
We need it
That's good.
really badly.
Yeah, so it is. It's a critical need, and the campaign is focused on expanding the emergency room to include 6 new beds for patients, but it also includes programs and services and resources that can support patients and their families. And so that's really big coming up. We also have the Breast Health Fund, and so that helps patients who are uninsured have access to mammograms.
Right, yeah, that's an important one.
Absolutely, and I mean, we recognize that this month, but all year round, that's a need. And we also have the Patient Assistance Fund, and so that's going to be assisting patients with prescriptions and also equipment they need to be safe once they leave here.
Getting back, touching on the emergency room expansion, is that for a specific type of patient?
It is. So it is for our behavioral health patients. And so we see behavioral health patients coming in our doors. And so to really be able to give them the space that they need, but also the resources to support those services, that's what this campaign is all about.
That's really important because the comfort level of that patient is a little different than a trauma patient or something like that. And so to have those designated beds and those designated resources for those behavioral health patients it's a wonderful thing for the patients, but also their caregivers.
Absolutely. I mean, it's the nuances of the whole system and how it works together, but this campaign is going to make a big impact on the whole medical center, including the team members as well.
Yeah. That's an important ask, and I love to see more information out there about that. So hopefully this TV show will help spread the word a little bit, and because I think it's a worthwhile area to donate your funds to. And those are all great projects. I mean, they all are. But today I want to talk about the year end, and people start thinking about what they need to send funds to, or how can they best use their extra funds. So tell me about holidays and year end. What do you think?
Sure thing. So certainly the holidays are a time for reflection and about what's important to you personally, but also where is it important to give those dollars that may be available. So I would ask that the community and our viewers keep in mind the behavioral health campaign. The need is great.
Need is great.
It's a national crisis. We've seen that programs and services can be really beneficial. For example, a couple of years ago, the foundation secured grant funding for telehealth psychiatry services in the middle schools. Yeah.
Who knew?
And so exactly. I mean, and it's been so successful. We know that this is the right place to be focused on. So our goal is to raise $2 million. So I would say that a gift.
Wow, Elizabeth.
I know, right?
That's a big number.
It is, but I know it's doable. And a gift of, if it's $5 or $5 million, will make a great impact. So I would say top of my Christmas list is for viewers to consider making a meaningful gift to the Novant Health Brunswick Medical Center Foundation and to this behavioral health campaign.
So if anybody has any questions, they can just reach out to you personally. Is that right?
Yes, absolutely.
Great. Or if they call the main number, they can just say, I need the foundation person, right?
Yep, and hopefully they'll give me a ring.
Well, I hope to have you back next year after the holidays to see how we're going and see what else we can do to get the word out.
That would be so fantastic, June. Thank you.
Thank you so much for being here. Welcome to Novant Health, and it's been a pleasure to work side by side. Our offices are actually next door to each
We're
other.
neighbors.
So that's great.
Yeah.
So, well, thanks again.
Thank you so much.
Please welcome my next guest, Dr. Christopher Swiger, and he's with Novant Health Heart and Vascular Institute. Welcome to the show today. So nice to see you.
Thanks for having me.
It's my pleasure. It's my pleasure. And I always start off, especially with new folks that have never been on the show, I like to learn a little bit about their background. I like for the folks in the community to get to know who you are. So talk to me a little bit about your education, where you went to school, did your fellowships, that kind of thing.
Sure. I was born in Texas, but
Really?
Grew up in Charlotte.
Oh.
And so came here to vacation when I was a kid. Went to both undergraduate and medical school at UNC Chapel Hill, and then went to Baltimore for residency at Johns Hopkins Hospital before moving to Nashville, Tennessee to go to Vanderbilt for my fellowship. And my last year...
You have how many fellowships, don't you have?
Really just one in cardiology, and then there's kind of a sub-fellowship in cardio-oncology.
Wow. You've traveled around for your schooling. You've been just about everywhere.
Yeah.
You've been all over the place. Tell me a little bit about cardio-oncology, because that's what you are, right? A cardio-oncologist. So what does that really mean?
You know, the goal of cardio-oncology is really just to, it's the same thing as oncology, which is to help patients get to a point where their cancer is cured or it is a stable, manageable chronic disease. So we are essentially just part of the cancer team. And traditionally, cardiology and oncology have been these very kind of siloed, separate specialties that didn't communicate particularly effectively with each other. But with the increasing recognition that heart disease and cancer are very much related to each other, there's been a need for people to bridge the gap. So that's sort of enter the field of cardio-oncology. So cardiologists who help cancer patients and the cancer team kind of all along the journey from the time of diagnosis to survivorship. So my job is to just make sure that any hiccups that occur along the way, or if you have pre-existing heart disease, that we kind of optimize you heading into treatment. It's just to help get to the finish line.
So does one disease affect the other one? Does like cancer affect your heart, or does heart disease, they just complicate one another? Yeah,
they certainly complicate one another. They get in the way of each other. A lot of the things we do for cancer are far more complicated if you have existing heart disease and vice versa. But I think what we're really recognizing now is that they share risk factors. So, I think we all are familiar with the idea that tobacco use will put you at risk for cancer and heart disease, but it's beyond that. It's really all the traditional cardiovascular risk factors that we first started identifying in the 80s and 90s also, as it turns out, tend to lead to many cancers.
That's really interesting, and it seems like it's really valuable to the patient because it's more comprehensive. It's to me, it sounds like it's a more rounding, it's a more roundabout way of taking care of both of those. But being a cancer survivor myself and still in treatment, I'm intrigued by what effect that could have on your heart, and I can understand why folks might seek out somebody like yourself. And are you the only cardio-oncologist with Novant Health here locally?
Here in this region, yes, but it's not just me. It's a big team.
It's a big team.
I have a nurse navigator. We have 2 physician assistants, We have a slew of nurses and medical assistants, and so it's really a
team effort. Well, I know that you partner with Zimmer Cancer Center at New Hanover Regional Medical Center, and I too am a patient there. And so I understand that philosophy and how I have so many caregivers there, and they all do different things.
Yeah, but everybody's in the same building, right?
In the same building.
That was
and
a
they're
big
all in the
goal.
Same team.
Yeah.
And the same medical record, and that makes it so much easier for the patient.
Sure, you don't have to learn a new parking lot, a new process for checking in. If I can keep your kind of medical home in one place and we can deal with everything in one building, I think it's to the benefit of everybody.
Right. Do some patients, do they need to strengthen their cardiovascular health ahead of like cancer treatment?
Yeah, certainly. Cancer treatment.
I never thought about that.
It's sort of a marathon, right? Physically, emotionally, and you really need to be in good shape. So if you have pre-existing heart disease or risk factors, we work really hard to optimize, kind of with medications, but also just with lifestyle choices to heading into the battle that you're in best possible shape.
Yeah, you need to be in fairly good shape to go through the treatment.
Yeah. We see a lot of people kind of upstream of their chemotherapy to try and get them in a good place.
Yeah. I heard about, excuse me, a program that you have there called CORE, C-O-R-E, Cardio Oncology Rehab Program. Can you tell me about that?
Sure. There's been a national movement for cancer survivors and people going through treatment to do a traditional cardiac rehab program.
Really?
And it's, having been through it yourself, I'm sure you can attest, treatment really wears on you. A lot of people are left feeling tired and frail. Their exertional capacity,
That's That's how I feel.
Their ability to kind of tolerate exercise isn't what it was before. And so we have exercise physiologists, nutritionists, kind of stress management experts who help our patients who are in every stage of cancer, every stage of sort of their battle with cancer, to get back in shape. The nice side effect is that we often identify a number of cardiovascular risk factors like blood pressure that are undertreated, and really they're kind of great advocates to circle back with the physicians and help the patients there. And the other thing is probably if you ask the people who've gone through the program, we've been doing it for about 2 years now.
Really?
The greatest benefit isn't the exercise, or any of the things I'm talking about. It's the camaraderie. We lost a lot of support structures for cancer patients during the pandemic.
Right.
And this has been one way to try and get that back. So
it's more like a family, and you can commiserate with one another.
Yeah.
You talk to each other about how you feel and they
war
feel.
Story swapping.
Yeah, it's war stories. You're right. I love that. Well, those where do you get the? Is it a regular cardiac rehab facility where you go through the CORE program?
It is. Right now, it's just at our Wilmington facility, but as we expand with the new medical office building down here in Bolivia, we're also planning to offer it down here.
So when you're seeing patients, I'm curious, are there any misconceptions about heart health that you want to bring up?
Yeah, the biggest one is that I think we've all traditionally viewed heart disease to some degree as the person's fault, right? If you have a heart attack, it's because of the choices you made. And conversely, we've viewed cancer as something that just happens to people.
Yeah.
But really the truth is in between, right? The risk factors for one lead to the other. And so a lot of our risk for the number one and number two cause of death in our society is related to the lifestyle changes we make. But there are also random events, people who are wonderfully healthy who have heart attacks, people who are perfectly healthy who get cancer. So the truth is very blurred.
I would never get that, you know?
Yeah.
I'm so healthy. I never get sick. Yeah. So I would love for you to come back, especially after we open the new building and we start the cardio oncology or the CORE program here. Would love to have you come back. It's such an interesting topic, and I don't think it's not one I've heard much buzz about. I don't really hear people talking about cardio-oncology. I think it's relatively new for the southern end of the county. So I hope you'll come back and be our guest again.
Sure, I'd happy to be.
Great. Well, it was a pleasure meeting you. I'm so glad that you're here, and I'm really glad for our patients here in Brunswick County. So thank you so much.
Thanks for having me.
Please welcome my next guest, Jennifer Blevins, family nurse practitioner from Novant Health Express at Walgreens, located in Leland. Jenna, it's so great to have you here today.
Oh, thank you.
I think it's been a long time since you've been on our show.
It's been at the very beginning when we first opened the little Express Care Clinic.
That's right. So you've come a long way. Boy, I can't wait to hear about what all has changed. So before we start, tell us a little bit about your background and where you went to school.
So I'm a family nurse practitioner. I went through Walden University for my master's degree, but also went through Old Dominion University for my bachelor's. So that's pretty much my schooling there. I've been a nurse practitioner since 2016. I started more with family practice and then merged over to more of an urgent care setting for a good while, and kind of do both family practice and urgent care, same day problems.
Did you always want to be a nurse practitioner?
So I started out my career as a lab technician years ago. So
that's awesome.
I figured when I was doing that, I knew then I wanted to do more. So I went to school for nursing and then just kept going through there. Yes.
Awesome. Kind of from the ground up.
Yes, definitely from the ground up, for sure.
Yeah. So let's talk about the Novant Health Express at Walgreens. That is a mouthful. What kind of patients do you see there?
So we see a lot of same-day appointments, same-day problems, something that just comes up more acutely with the patient.
Yeah.
Sickness, illness, urinary issues, pretty much anything that is not their normal everyday issue. We do follow some family, practice guidelines there, because we are an extension with the Leland family office.
Yeah, the Oceanside Family Medicine.
Yeah. So a lot of times we also act as an extension to their practice, and we see anyone and everyone, but sometimes if patients can't get in to see their primary care provider for a certain amount of time, we are that person, that middle person as well. We make sure that they are followed with their medicines, their chronic issues, any kind of acute needs that kind of come up too. We're there.
And like weekend coverage.
Yes, so we are open on weekends as well, and that is a good extension, to
that's awesome.
the weekly hours.
Yeah. Can you check in online for an appointment there?
Yes.
Did you go through the Novant Health, or did you go through Walgreens?
You go through Novant Health.
Awesome.
We are not actually Walgreens. We're just in the facility of Walgreens, but we still provide, urgent care services to the patients of the practice and to anyone and everyone that needs something.
Yeah. It's really nice too. When I toured that, I was so surprised at how this small area could be so accommodating.
Yes.
And so nice. I mean,
it is nice.
I love
small.
The doors. I'm all about those doors.
But it is very, we have 2 exam rooms. We have, a patient bathroom, and we also have our lab in the office.
Yeah.
It's compact, but it does a lot of good services.
Yeah. So let's talk about the types of patients you're seeing. I know summer was a really busy summer with respiratory bugs and all that kind of stuff, especially in kids. So have you seen a lot of that, of respiratory issues?
So there has been a very big uptake of respiratory illnesses in kids and, adults in general, especially here lately. I think, since school starting back again, that has really brought on a lot of the respiratory, viral illnesses. There's been a pretty good uptake with, RSV in our child population. And we definitely see a lot of that, treat that, as well as educate, the families on signs and symptoms to watch for more of a respiratory distress that we would require them to have further evaluation, that type of thing. But For the most part, we see all ages,
Okay.
all the way from birth all the way up.
Really? I didn't realize that.
Yes, we do see all ages. Yep.
So this time of year, getting into December and what have you, I imagine we're getting into flu season. Have you seen
Yes.
any flu yet?
Oh, it has started.
Really?
Yes. This week have had a lot of positive flus. There's been flu A, definitely there's been a couple of cases of flu A and B.
Really?
So, it's out there and it's pretty common this week.
Geez, I'm glad I got my flu shot early. I got mine
Yes.
October 1st.
Yes. It's been it's definitely getting more prevalent here in the last week to be seen.
Yeah. So if you have a cold or the flu, when is it the right time to see you? When do we need to come in?
So honestly, with testing for COVID and all of that, we all have access sometimes now to the home COVID tests.
Right.
We can do those at home. We also offer more of the send-off COVID testing at the clinic at Walgreens. We're usually getting about a 24-hour turnaround time for our COVID tests, the send-off PCRs.
Right.
And, we do the in-house influenza testing. So that is something that will be done, during the visit there. If somebody has
For
symptoms,
both A and B?
yes. Okay. So, honestly, if there's a concern, I would just come on in. Yes, I would definitely go ahead and make that appointment. We do offer online scheduling, open scheduling through the website. We try to accommodate as much as we can walk-in patients. We do have appointment slots as well. People can also call the main Oceanside office to get an appointment scheduled too, if for some reason they have online difficulties or computer problems. That's another way to do that. You can also walk in and we can see what we can do then. So those are all the options.
It's good to know that you have walk-ins. You may have to wait a little bit.
Yes, we try to accommodate that as much as possible. There's two of us working, usually myself and another CMA medical assistant. So if there's place that we can fit you in, we definitely try our best to get that accommodated. Also, if there's any openings in the schedule, if someone doesn't want to wait and they want to come back, say at 3:00 p.m., then we reserve that spot for them and go ahead and put them on the schedule if they're willing to come back during that time. And we make sure we offer all those options.
What are your hours?
So Monday through Friday, we are open 10 to 8 p.m. and we do stop for lunch from 2 to 3. That's Monday through Friday, the 10-hour days. On the weekends, we are open and available from 10 to 3.
10 to 3. That's great to know. Yeah, because sometimes on the weekend, my kids always got sick on the weekends.
Yes, but it's always after hours too. So at least we're open in extension to the primary care office.
Right.
We have those extension hours too.
Yeah. What kind of vaccines are you giving? They're at Walgreens, correct?
Yes. So in the little clinic, the Walgreens Express Care Clinic, we are administering flu vaccines.
Great.
We do those. We also offer tetanus vaccines if someone has a laceration. We will also do that a part of their visit that day.
Awesome.
Puncture wounds, we would update their tetanus, that type of thing as well. We do PPD testing as well for tuberculosis. Usually if it's other vaccines, we would refer them to the Walgreens site at the pharmacy for their COVID vaccines, shingles vaccines, things like that.
Well, Jennifer, it's been so good to have you back on the show today.
Well, thank you for having me.
Yeah, this is the time of year where we have to start talking about colds and flus and all that
Well,
kind of
it's
stuff.
coming.
It's
It has
coming.
already hit.
All right.
And this week has been very busy with that.
All right. Well, thanks so much, and I
You are
hope to see you
welcome.
soon.
Okay, thank you.
Thank you for tuning in to HealthWatch. I hope this information was beneficial for you and your family. To find a doctor or learn more about services provided by Novant Health, please visit our website at novanthealth.org. I do want to wish your family a healthy and a safe and restful holiday season, and be sure to join us next time for HealthWatch.